Welcome everyone. Employee counseling and health education. This is the topic for the discussion in this particular video. We will be talking about ECPs. ECP stands for Employee Counseling Program, and we will encounter this particular term quite frequently during the presentation thereby. So what is ECP or what are employee counseling programs? A confidential, perhaps a comprehensive program of counseling services for the employees, and definitely it can be extended to the families depending upon the policies of the company. Usually the employees are covered. Often, many a times it has been seen that decent companies will extend employee counseling programs even to their families, because as a family they tend to work around. why are why employee counseling program? Because this is designed to reduce risk. This is designed to cut cost. This is designed to enhance productivity of an employee, and thus the profitability of the company depends upon it. Some employee counseling providers offer services such as retirement assistant, as in early retirement, as in on-time retirement, as in planning for the retirement services, employee counseling and health promotions, fitness, crisis management. And we have different stages of crisis management in our day to day life, in our personal orientations, and probably in our professional orientations too. Further examples are all about alcohol and substance abuse, domestic violence, and stress management. Now, you admit it or not, but the percentage of people utilizing a substance abuses or probably some sort of violences. I'm not talking about only physical violence, it might be emotional violence too. uh, they encounter, a majority of the employees would be encountered, and people do get stress around it. So what are ECPs, or what are employee counseling programs? As the depicting the figure, you see this gentleman is actually putting much more stress on their forelimbs, as in to build up a mental pressure with a physical presence altogether. Cost effective employee benefit that can improve the employee health, perhaps the morale, and limit healthcare costs. If you are healthy, uh, in a healthy body lives a healthy spirit, right? As they say, the main objective is prevention. The main objective is the organizational wholeness. Example include exercise, relaxation classes, financial counseling, and probably weight management. Most of the cases it might be obesity, but then there are few cases where people are actually below their requisite weight per se. So, where did this thing began? The employee counseling program, the concept began. It well began in the mid 1960s, probably to mid 1970s, when people were supposedly looked as an asset. Workplace counseling focused on addiction, probably all about alcohol and substance abuse. In mid 1980s, the impact of health benefit cost containment approaches brought about a considerable changes in the consolidations, as the case might be. Today, the market is divided. Today, it is divided among several large national behavioral health and assistance provider. In fact, providing employee counselors has become a lucrative business for a certain number of companies who are into counseling as a extended services that they may be providing to the different companies altogether. You look, the gentleman and the lady wonderfully having a conversation, as in they are talking about implementation, as in they are trying to build up a camaraderie, they are trying to build up a team spirit, probably inculcate the values of trust, honesty, and transparency in their relationship. So what is all about the implementation? It might be internal or in-house, or it can be a consortia. Now, when I say consortia, there might be an external agencies who might actually extend counseling services not only to one particular company but to n numbers of companies. So that can be consortia, or certain physical ailments, certain psychological ailments, certain emotional outbursts can be contained by a number of specialty organization, clinics, or perhaps professional who can pull in their resources and cater to such requirements as far as the companies are concerned. Now, it can be a fee based contract, or it can be a fixed fee contract for a number of people on behalf of the company that the employee counseling programs would be serviced around it, and there might be a peer-based program as the case suggested. So why? The question is, why do we offer employee counseling program? You look, this is what we are talking about, improving performance, and the picture shows around it. If a healthy body and a healthy spirit, if they coexist, it means the productivity is going to be an optimum level. So unlimited positive outcomes, no doubt about it, leads to a more energetic, positive, and productive workplace. We are talking about reduced employee turnovers, lower overall healthcare cost, and reduction in the on-the-job accident, as the case might be. Why should we offer employee counseling? It has been noticed that up to 68%, that means more than two-thirds of the employees, and that is surprisingly all consist of a majority of workers will at some time experience workplace problem severe enough to prevent them from coping with the day-to-day activities. They succumb to the day-to-day problems that is prevalent in the workplace. Many a times almost two employees for every three employees to be considered or evaluated as a prevention tool, as a form of managed care, as a multi-purpose human resource tool, or also a way to show that you care. And that is the reason we should be offering employee counseling programs. Cost issues, the return on investment is absolutely fabulous. It is in favor of 3 is to 1 in the first year, 4 is to 1 and the return on investment thereafter. So first year it actually boosts your morale of your employees, like it catapults the morale at the highest of the realm. That's the reason Johnson and Johnson, let me recollect, spends around 4.5 million to prevent on preventive healthcare program. Estimated that without preventive measures, the medical bill would be approximately 13 billion or $13 million if you look into it. So that means within a fragment, one third the cost of employee counseling program, they are actually saving a whooping sum of money that comes around it. So let us understand the cost of implementing the ECPs, employee counseling program. Now I am trying to give you a notification that has been properly published and established in US, wherein you have more than 5,000 employees. The cost range is approximately $14 to $25 per head, right? That means that is the cost range. So average cost is approximately $20.29. Similarly, for 1,000 to 5,000, it would be $17 to $39 on an average, 20.42 cents to $20.42. In between 500 to 1,000, it makes sense, believe me or not. If you look into it, even the consortia where we are talking about cost mean, it is somewhere around $10 to $25, and on an average it is around $18. Fewer than 25 employees, remember. In fact, maximum number of organization, around 88% of the organization in United States employ less than 25 employees, and that the cost range is around $30 to $100. Absolutely, in a mean, overall mean would be around $50 per person per employee. So what can the ECP do for your company? One of the major thing is it's a high return on investment. Did I mention the Johnson and Johnson say investment in ECPs are around $4.5 million, and probably they save health bill of in the tune of $13 million if you're looking into it. So look at the high return on investment just on the medical bill, and I am not stressing upon the productivity improvement. Lower medical claims, as the case might be, decreased use of mental health insurances. Obviously, yes, if people are in healthy spirit, why should they go for it? Health insurances. A reduction in the turnover of employee, the attrition rate doesn't goes up. Increased employee productivity as a result. This is what we are looking. Look the advantages. Look the benefits. Look what a wonderful impact that ECP does for your companies altogether. On the other hand, if you don't have any ECP, what will it mean? It means you are going to reduce productivity, you are going to reduce morale, you are going to reduce profits, increase in the healthcare cost, increase in the job accidents, increase in more claims, increase in litigations. There are so many things that are negativities that are there, which I've even not listed for you to understand. Remember, if there are accidents, there would be litigations across you. If there are increased healthcare cost. You are only paying for unproductive, unwarranted cost altogether, and this is pulling down your profitability of the company. So, doesn't make sense not to have an employee counseling program thereby. Now, the current problems in 2017, just before the pandemic, the survey showed around 47% of the companies offered exercises and fitness program. Lack of participation if the companies do offer them. Many smaller and medium-sized firms are still in the process of implementing employee counseling programs. The issues are employees are afraid to seek help in fear of employers may find out, state of denial of problems as the case might be. We are talking about cost saving in action. If you look around here, several, I believe me or not, more than a dozen studies have demonstrated that employee counseling program provides a payback of approximately $4,000 to $7,000 for every $1,000 invested. Approximately 4 times to 7 times what I'm talking around it. It for every $1,000 invested, it gives a return of minimum of 4,000, maximum 7,000 in a mean of around 5,500 that comes around it. Abbott Lake County showed that 6 to 1 payback through saving in health insurance premium. Now, talking about stress, this particular slide I've included for you to understand now that everybody is under stress in one way or other way. No wonder this wonderful lady must be sitting, but probably think about the animal below it. And similarly, no wonder you must be moving or driving in a plush car, but probably the prices of gas is pushing you to think twice should you take out your car or otherwise. Now, these are the reasons that needs to be taken into consideration. Let us talk about stress. A recent study by the National Institute of Health indicates approximately 70% of the illnesses are stress related. Yes, I have seen it. I have encountered it from a very close quarters as to what stress is all about it, directly linked to heart diseases, lung ailments, accident, cirrhosis. Cirrhosis is a problem with the liver. If you are considering of cirrhosis of the liver and the suicide that comes around it, it is quite of a dangerous consequences. These kind of diseases comes around it. One of the manifestation of stress is absenteeism. Believe me or not, psychological problem accounts for approximately 61% of the absences from work each year. 65 to 85% of the employee termination, 80 to 90% of the industrial accidents only happen because of stress and stress related ailment. Look what is happening with the pig. The chair is revolving for no reasons and no rhymes. The people are vacated in the workstation. Estimated 1 million workers keep themselves absent on an average workday because of stress related issues. Now, this is what been published by American Institute of Stress way back in 2000. Unscheduled absenteeism cost employers as much as around $688 per employees per year. And believe me, it is a loss not only to the employer, even the employee stand to lose his daily earning because he actually bills the company per hour of his presence. So mental health, more than 54 millions of Americans have mental disorders. If any given years, although fewer than 8 million seek treatment, if we look at 54 million and look at 8 million, it is just a fragment of the things who actually seek for mental health ailments or treatment thereby. So depression and anxiety disorder, the two most common mental illness, each affect the 19 million American adults annually. The National Institute of Medical Health way back published in 1999. And these are the reason why you should take into consideration what happens with depression, what happens with decreased productivity, what happens with lost work days, and we can keep on talking about the pitfalls of stress, pitfalls of mental health, pitfalls of the modern day productive life that individual puts in. There is a grief. Around 30 million people grieve each day. Each day, am I saying, in United States, the employer cannot afford to ignore grief. As in, the source is United Behavioral Health. Up to one half of all visits to primary care physician are due to this condition. We are talking about collaborative family healthcare coalitions. Remember, 20%, approximately 20% are suffering from clinical depression, and every depression that has been suffering are being an outcome of stress. So 2 out of 10 people actually are suffering from clinical depression. That's whooping 20%. We talk about substance abuses, right? Yes. And one of the easiest way to deflect stress or deflect mental health is to get yourself intoxicated. 40% of the industrial fatalities, 47% of the industrial injuries are linked to alcohol consumption and alcoholism. Around 36% of the employees' thefts are directly related to drug related problem. Why? Because they want to fund their habits, fund their abuses of substance as a habit per se. Drug reliant employees incur 300% higher medical costs. Perhaps the benefit compared with the healthy workers. Approximately one fourth of the drug dependent employee salary is lost through increased use of medical benefits. So it doesn't adds up. It doesn't have to the quality of life. It doesn't have with the uh, with the living standards at all. In fact, once you are a slave to a substance abuse, a wrong habit that if you want to actually be a slave to, you are only demeaning yourself, your family, your health, and so forth. So workplace violence, another of the pitfalls. We have murders. We have a claim of approximately 1,000 people almost on an average of each year. Another 2 million people per year are victim of violent events or threat at the workplace. When these doesn't relate to a capital punishment altogether, the eventualities, the fatalities does not occur, but grievous injuries does happen. Approximately 2 million times people have been threatened, people have been physically pushed, shoved, probably even beaten per se. No, even if it is not physical, mental scares, the emotional scares actually remain on an employee. So employee counseling program has three tools to reduce the risk of workplace violence. Number one is confidential and accessible consultation. Number two is anger management, and number three is assistance to the supervisor who are addressing the potentially violent situation. Everybody is a threat in such kind of volatile environment per se. Now we talk about the violence. Studies indicates the workplace violence cost American business anywhere from $6.5 billion to 36 billion annually. On an average, it costs a company approximately $53,000 per event in terms of lawsuits, in terms of worker complaints, compensations, and compensation claim thereby, the public image notwithstanding as such. So how do we go? I would love to end this particular presentation with two slides with not much, but probably give you the right picture as what can be done to seek or probably elevate stress from your life. Keep the mental health at bay altogether. The best way is fitness. Fitness is the key to prevention. Be physically active, and that's the reason I've kept it a photograph where you can do yoga, perhaps you can do running, you can do walking, you can join a gym, you can practice free hands. Keep yourself moving, keep yourself active, keep your hormone at the optimum level. If you look at it, apart from the exercise, eat right. Absolutely, eat fresh vegetable, eat protein, and eating right itself will take and keep your mind fresh and healthy. With these words, I come to an end of this particular presentation. I hope you are going to follow whatever has been discussed during this presentation and keep your health of prime importance. With this, I sign off.